Warming needle and Moxibustion over medicinal cake. Warming needle. Moxibusted acupuncture, also called warm needling, has the comprehensive treatment effects of both acupuncture and Moxibustion. A commonly used therapy in Zhejiang clinical practice, it is quite effective in the treatment of such diseases as yang qi deficiency syndrome and excess of yin cold. After several decades of systematic research, as well as clinical practice on Moxibusted acupuncture therapy, Gao Zhengwu, professor of Zhenzhou and Tuina Department, Zhejiang College of Traditional Chinese Medicine, created a set of effective methods which had enriched its use in differential treatments and improved its therapeutic effects. The following is a detailed discussion of the results of the Moxibusted acupuncture in lab tests and clinical applications, respectively. Experimental test. Different needles. Various kinds of commonly used clinical needles are grouped by size and by quality and tested respectively. Room temperature, 18 degrees centigrade. 0.8 grams moxicone. Equally divide the needle into 8 parts and measure the temperature of each part 3 to 4 times. Light, 1 moxicone. Measure the temperature. The needles tested are number 30 needles of 1.5 inches in length, made from different materials. The results are as follows. The silver needle has the highest temperature, then the steel and the stainless steel come next. For needles made of the same material, but different in size, the thicker, the higher the temperature. For needles made of the same material, but different in length, the shorter, the higher the temperature. When needles are of the same size, the temperature rises at a faster rate and remains a longer time in silver than in stainless steel. But for needles of different size and length, the greater the size and length, the faster the temperature rises and the longer it remains there. Different moxicones. The size and number of moxicones have various effects on the quality of Moxibustion. The following test is done at room temperature 32 degrees Celsius. Put 4 needles of the same size and same material on each of 4 moxicones, which weigh 0.3 grams, 0.5 grams, 0.8 grams, and 1.5 grams respectively. The results are various with regard to the burning time, highest temperature of the needles, and the duration of keeping the temperature. The loose moxicone burns up quickly, bringing higher temperature. The firm tied one burned up slowly with lower temperature. Burning a second moxicone doesn't raise the temperature any higher than the first one does. Therefore, burning additional moxicones only extends the time of Moxibustion. Clinical applications. When applying the Moxibusted acupuncture in the clinic, the selection of the needles and moxicones should be made discriminatively on the basis of differentiation of the disease, individual, points, and time. different seasons. In summer, a person's pores are open and all Jinglo are unobstructed because of the hot weather. To treat patients suffering from rainy, cold, and damp bee syndromes with Moxibusted acupuncture during the summer season, you have twice the effect with only half the effort. While applying Moxibustion, you should take the patient's physique and disease condition well into consideration in the selection of needles and moxicones. Quite often, one moxicone per treatment is enough. In winter, because of the cold weather, the pores of the skin are closed, and the disease may get worse in the case of bee syndrome. Therefore, you may apply a thicker needle to a relatively deeper layer with a bigger moxicone, or you may increase the number of Moxibusted acupuncture in the therapeutic area so as to have better effects. All else remaining the same, the patient should be treated differently in different seasons. Different body conditions. Differences in age, sex, physical conditions, and sensitivity to Jinjo of the patient should be taken into consideration during Moxibustion. For the average patient, select a medium-sized stainless steel needle with a 0.8 clinical moxicone. For the patient of strong physique who has suffered from the disease for quite a long time, apply thick needles or silver needles if necessary, with 2 to 3 large moxicones burnt successively. For the aged or weak patient, choose thick needles and a small moxicone, no more than 1 piece. As it is not appropriate for children to have acupuncture needles retained in the body for long, it is rare to use Moxibusted acupuncture for them. Case 1. The patient is suffering from rheumatic arthritis, which belongs to bone V syndrome in TCM diagnosis. Lab examination shows rheumatic factor positive, X-ray examination shows ossification and degeneration of vertebral body and bamboo spine. Select Jiaji points with interval and alternate points on both sides of the spine. The two groups of points are applied alternatively. Use number 26 steel needle. Apply twirling reducing method with 2 to 3 pieces of moxicone. Case 2. For the treatment of an old woman suffering from scapulohumeral periarthritis due to accumulation of excessive yin cold, use a number 32 stainless steel needle only because of the age of the patient. At points Jianliao, Jianyu, Jianneiling. Binao. Shousanli. Apply 0.8 grams of moxicone. The patient is treated every other day with 10 sessions as one course. Take a week's rest before having another treatment course. Different diseases. In the case of Wei syndrome, B syndrome, paralysis, and those with obstruction of Jingluo, use thick needles and heavy moxibustion. In the cases of deficient cold syndrome of Zangfu organs, use thin needles and light moxibustion. Case 1. The patient had a long history of pain in his knees, and the treatment with thin needle puncturing seemed to have little effect. The doctor then applied thick needle points instead at points 血海, 两丘, 内外细炎, 足三里. Use a thick silver needle at 足三里. Light 1 gram moxicone. Blisters may appear on the applied area. They should be drained on the third day, and caution should be taken to prevent infection. The therapeutic effect is remarkable in this case. Case 2. For patient with diarrhea caused by spleen deficiency, apply light moxibustion with a number 32 stainless steel needle to the points. Tianshu, Qihai, Xiangjuxu. All the points are manipulated with rapid, slow reinforcing method with 1 lit moxicone on each. Different parts of the body. Different needles and moxicones should be selected for puncturing different parts of the body. For points on the yang meridians located in the lumbar region, back, around the shoulder, elbow, and knee joints, choose thick needles and big moxicones. For points on yin meridians situated in the chest, abdomen, wrist, and ankle joints, thin needles and small moxicones are appropriate. Case 1. The male patient has backache and walks with a limp. For treatment of pain in the lumbar region and knees, puncture 质边、环跳、锯疗、阳陵泉、悬中。Apply a number 26 needle to the 3 points at the hip and a number 30 needle to the rest of the points. Two to 3 moxicones are used on each point, with bigger ones at the hip. Case 2. The female patient has suffered from facial paralysis for 3 months, with low local skin temperature. Use a number 34 thin needle and apply the penetrating needling method. Yang Bai penetrating towards Yu Yao. Tong Zi Liao towards Taiyang. Yin Xiang towards Sibai. And Di Cang towards Jiache. Apply a number 32 thin needle to Xiaguan, Yifeng, puncture Hogou on both sides. Moxibusted acupuncture at Xiaguan and Yifeng using 1 moxicone each. Precautions. While being retained in the point, the body of the needle should be perpendicular to the skin surface. No moxibustion should be used if puncturing is in a horizontal or oblique insertion. Set the moxicone in the handle of the needle with the tail just visible. The lid end of the moxicone is about 3 centimeters in distance from the skin, but can be a little closer in winter. The moxicone should neither be too loose nor too firm. Fasten the low end of the cone gently to avoid falling. Avoid big vessels, nerve trunk, and the vital organs when applying thick needle and silver needle. If many moxicones are used and are too close to the skin, or are used at some sensitive part of the body, insert a piece of paper in between the moxa and the skin to reduce heat radiation and conduction through the needle. It should not be used too often, lest it affect the therapeutic effect. Moxibusted acupuncture with thick needles or silver needles easily forms blisters. The size of the blister indicates the quality of Moxibustion. Over 46 degrees Celsius causes a millet-like blister, and over 80 degrees Celsius produces a bigger one. Strict disinfection procedures should be followed when a blister is formed. After draining, apply gentian violet solution to the area to avoid infection. The most important part of clinical application of Moxibusted acupuncture is the differentiation of syndromes and the right selection of needles and moxicones according to the patient's disease condition and physique, disease location, and the time of Moxibustion. The proper application can achieve better therapeutic effect. Moxibustion with medicinal cake. Moxibustion through herb medicinal cake is a Moxibustion therapy by which a medicinal cake is placed between the point and the lit moxicone. The earliest record of such a therapy dates back to the prescription in Tianjin Yao Fang by Sun Miao of the Tang Dynasty over 1,000 years ago. Some new developments of the therapy have been made in our times, though. The medicinal cake is made of fine powder ground from Chinese medicinal herbs, mixed up with rice wine or water. The cake is then put on the selected point. The lit moxicone is placed on the cake. The therapy has both Moxibustion and medicinal effects. It stimulates the flow of qi by warming the meridian, strengthens the positive factors in the body, and expels pathogenic factors. There is a variety of medicinal cakes made from Chinese herbs, but the following 5 are the most commonly used. Shuangbu cake used to tonify qi and blood by supplementing warmth. Yiyang cake, good for warming yang and expelling pathogenic cold. Chuyu cake, used to stimulate blood circulation and remove blood stasis. Xingqi cake, having the functions of promoting qi circulation and removing obstruction of the collateral. Shaoyin cake, effective for dispelling retained water and relieving swelling. Preparation of medicinal cake. Put a proper dose of medicinal powder into a cup. Then, add a suitable amount of rice wine and mix it up thoroughly. If the weather is chilly, the wine ought to be warmed first. The paste should not be too dry nor too wet. Add some more powder if too wet, or add some more rice wine if too dry. Put the completed paste into the cake mold and press it into a cake. Remove the cake out of the mold and put it aside on a plate for later use. The medicinal cake is about 0.4 to 0.5 centimeters in thickness. Preparation of moxicone. Put a proper amount of moxie into the cone mold. Press it to form a cone shape. Remove it from the mold and put it onto a plate for later use. Method of Moxibustion. The process of applying Moxibustion should be done in the following order. Fix the patient's posture, expose the points, clean and generally disinfect the place, put the medicinal cake on the point, place the moxicone on the cake, and light it. Remove the mox ash after the first cone is burnt up. Place the second and then the third. After Moxibustion, remove the cake and clean the local area with a dry cotton ball. If you measure the temperature of the bottom of the cake at that time, it could be around 45 degrees centigrade. Normally, the treatment is considered to have the best results if the local skin area appears reddish and the patient has a slight burning feeling. If the patient feels scorchingly burnt, move the cake about a little to prevent formation of blisters. If small blisters are formed at the local area, it is not necessary to give them medical treatment. They will heal all by themselves. Case examples of often treated diseases. Vertigo, deficiency of both qi and blood. The patient is a mental worker who has a history of vertigo. It occurs whenever he feels tired or does not have enough sleep. Recently, heavy workload and insufficient sleep have caused him to have a reoccurrence of vertigo. Looking pale and having an aversion to chill, the patient has a poor appetite, thready and soft pulse, pale tongue with a thin white coating, and low blood pressure. It is diagnosed as vertigo resulting from deficiency of both qi and blood. Treatment principle should be warm and tonify qi and blood and stop vertigo. Prescription: 百会, 足三梨. The patient is in a sitting position with both hands supporting his cheeks. Apply Moxibustion with shuangbu cake at 百会. There is a total of 3 moxicones. After that, the patient changes position and lies supine. Moxibustion is done with the same kind of cake at Zusanli for another 3 moxicones. The treatment is given daily or every other day, and a complete course consists of 3 to 5 treatments. Stomachache, deficient cold type. The patient has had stomachache for many years, and this time she had a really bad one as the result of having a cold soft drink. Vomiting, clear fluid, she tends to feel better when the epigastric region is covered and kept warm. Other symptoms include deep and thready pulse and thin white tongue fur. Treatment. Warm up and pacify the stomach. Stop pain. Prescription 1. 中丸 and Zusanli. Prescription 2. 胃舒. The patient lies on her back. Moxibustion is applied with Zhejiang cakes for 3 moxicones at prescription 1 points. From the second visit on, the patient lies on her stomach and is treated with Moxibustion with Zhejiang cake at 胃舒. The course consists of a total of 8 to 10 treatments given every other day. Stomachache, stagnation of qi and blood. The patient came to the clinic because he suffered from stomachache. Barium meal examination of the gastrointestinal tract showed that it was antral gastritis of the chronic type. The patient had severe epigastric pain, and it was so painful that when pressed, he would try to resist it. The tongue looked purplish with a thin coating, and the pulse was deep, weak, thready, and uneven. Treatment. Promote blood circulation to remove blood stasis, harmonize the stomach, and check pain. Prescription. Prescription 1. 葛舒, 胃舒. Prescription 2. 血海 on the right and Zusanli on the left. The patient lies in a prone position. Give Moxibustion with Chiyu cake for 3 cones at each point of prescription 1. The stomachache has been alleviated when he comes back for a return visit the next day. points Xuehai and Zusanli are then prescribed with the same Moxibustion method while the patient is in a supine position. The patient is treated every other day for a total of 8 to 10 sessions as a course. Chronic diarrhea caused by spleen deficiency. The clinical manifestations of diarrhea of this type are loose stools and poor appetite. Symptoms become aggravated after having cold food or food saturated with fat, accompanied by abdominal pain and lassitude. Weak pulse, swollen tongue with thin coating. Treatment. Warm and tonify spleen yang, strengthen the spleen and stop diarrhea. Prescription. Prescription 1, 皮舒 and 气海舒. Prescription 2, 气海 and 足三里. On the first session, the patient, lying on his stomach, is treated with Moxibustion with Yiyang cake for 3 moxicones at Pishu and Qihai Shu, respectively. From the second session, which started the following day, the patient lies on his back. The doctor gave him moxa at Qihai and Zusanli, respectively, with the same kind of Yiyang cake and the same number of cones. The 2 prescription points are Moxibusted in turn. Treatment is given every day or every other day, and 8 to 10 treatments comprise 1 course. Chronic diarrhea due to kidney deficiency. The patient suffered from diarrhea for nearly 4 years as the result of kidney deficiency. He had diarrhea with abdominal pain at dawn every day. Other symptoms included aversion to chill, soreness in back, deep and thready pulse, and thin white tongue coating. Treatment. Warm kidney yang, stop diarrhea. Prescription 1, Mingmen, Shen Shu on the left and Da Chang Shu on the right. Prescription 2, Yao Yang Guan, Shen Shu on the right and Da Chang Shu on the left. On the first visit, the patient takes the prone position. Apply Moxibustion with Yiyang cake for 3 cones at Mingmen, left Shen Shu and right Da Chang Shu, respectively. On the next day, use the same Moxibustion methods at the points. Yao Yang Guan, right Shen Shu, and left Da Chang Shu. treatment is given daily or every other day, and 10 sessions comprise one course. Uresis. The patient is suffering from retention of urine caused by a disorder of the lumbar vertebrae. Because he cannot urinate by himself, urethral catheterization is used to relieve the urinary distension. Treatment. Based on the principle of treating acute symptoms in an emergency case, promote circulation to diuresis. Prescription. 气海水稻阴灵泉 Apply Moxibustion with cake or sprouting cake for 3 moxicones at each point. The patient is treated once or twice a day. Cervical spondylosis. The patient has been troubled with B syndrome of the cervical vertebra for about 3 years. He feels distending pain at the nape and has stiff neck movement. The disease often flares when the weather gets cold or the patient is very tired. It is also accompanied by dizziness. Other symptoms include thin white tongue fur and thready and wiry pulse. X-ray examination shows enlarged spinous processes of cervical vertebra 4, 5, and 6. Treatment. Promote blood circulation and remove obstruction in the collaterals. Prescription 1. 大椎大柱 Prescription 2. 心摄陶道 The patient is in a sitting position with his head resting on the table. Apply Moxibustion with Zhejiang cake for 3 moxicones at 大椎 and 大柱 respectively. Use 行气 cake for Moxibustion at 心摄 and 陶道 with 3 moxicones each on the return visits. The 2 prescriptions and cakes should be used alternately with 1 session each day or every other, and 10 sessions in total for 1 course.
一路漫漫，披荆相伴，